Good afternoon, everyone. Thank you for your patience with us till the end of the day. I have two greetings before I start my presentation. We are in March, and it's a very special month for women because 8th of it is International Women's Day, so happy Women's Day. And just yesterday, 21st, it was the Arabic Mother's Day, so happy Mother's Day. And in line of this is my presentation, which is a common musculoskeletal problems in women, a case study of postnatal period. So musculoskeletal system is conditions which are affecting both systems, is the muscular system and the skeletal system, which is including the bone in the body. We have many conditions regarding these two systems, but they are having a common point, which is representing of pain as well as decreasing of the physical function. This musculoskeletal condition can vary from acute onset or short duration problems till a lifelong problems or chronic onset. Many examples of musculoskeletal conditions we have, like osteoarthritis, low back pain, neck pain, carpal tunnel syndrome, de Quervain syndrome, rheumatoid arthritis, and osteoporosis. Actually, it's not a small problem, but it includes a huge number of people worldwide. So it's affecting the biological part of the body, but as well the psychosocial status of the patients, as well as their families and carers. So it's a big problem. Differences in the documented injuries rates between women and men shows that the women are more frequently to complain from musculoskeletal conditions. This is due to gender-wise and reporting symptoms-wise. So many of musculoskeletal injuries are more frequently in women, which is highlighting that there are specific risk factors unique for women. But in the bottom line, when treating both men and women with similar orthopedic conditions, so the treatment should be similar by the end. This is an ethical issue. If we have a look over this illustration, based on many population-based research and larger scale epidemiological studies, it shows that women are more frequently to complain from pain or reporting pain. And they investigated different types of pain, like heat pain, cold pain, ischemic pain, pressure pain, either in the pain tolerance or pain threshold. And they found that women are more vulnerable to the pain and pain reporting than women. So why this pain perception difference in the gender? Actually, it's a complicated. But here, before I go for the explanation, according also the large epidemiological studies which were done in different geographical areas, they stated that women are at high risk to have chronic pain, clinical pain, more pain sensitivity, more pain facilitation, and reduced pain inhibition. Regarding the clarification or the explanation due to why women more reporting of pain, they said we have two mechanisms, biological mechanism and psychosocial mechanism. Regarding the biological mechanism, they are relaying about the hormonal difference. They said it's playing a very important role in the difference of pain perception between the two genders. These hormones, according to the female gender or female sex hormone, which are the estrogen and progesterone, they stated that both these hormones are having a complex effect as a pro-nociceptives and anti-nociceptives. Pro-nociceptives means that increasing the pain perceptions and tolerance and threshold, and it was found in the early follicular phase of the menstrual cycle in women. Testosterone, which is a hormone found in the males in a huge amount, this found that it has anti-nociceptive effect, which is decreasing the pain. So it's protective by nature. In addition, they found if they administer a small amount of testosterone in men who having a chronic stable angina, so their pain is subsiding down. So it has an analgesic effect. As well, they found an association between the decreased androgen concentration and the chronic pain. And by default, women having a low amount of androgen. That's why this is a relation between the chronic pain, high prevalence in women. another biological effect, which is the muscle mass or the cross-sectional area. It's decreased in men and women in comparison to men, so they are more vulnerable to develop the injuries. As well, the anatomical body build, as you can see here in the illustration, there is a difference in the body build between male and female. Female are by nature is smaller in total body size. They have narrower shoulder and wider pelvis, which increasing the valgus angle and more pronation in the feet. So women are at high risk to develop the injuries in the lower extremities. This is regarding the biological mechanism. So what about the psychosocial mechanism? As well, the coping strategy to handle pain, it's different between gender. So men tend to have behavioral distraction, a problem-focused attitude, while women having a different technique to handle pain, like self-statement, positive in a way, social support, emotional focus technique, cognitive reinterpretation, or reappraisal. So in total, they are different between the two genders in handling the pain. My topic was a case study of postnatal period. Actually, the women are going under several changes in their through life. So have different stages beginning from pregnancy, delivery, and what is after delivery, which is the postnatal period. During pregnancy, there are a lot of changes going on in the whole body systems: respiratory, circulatory, nervous, hormonal, cutaneous, and musculoskeletal conditions. All of these changes to have this little cute, innocent creature by the end of pregnancy, right? But after giving birth, the theoretical scenario says that all of these changes happen during pregnancy, going back again to the normal situation or pre-pregnant status, right? This is the theoretical, but actual scenario is not. All of these systems are going back except the musculoskeletal system. Why? Because there are physical demands to take care of the newborn, right? Maybe some of you see this illustration a little bit funny, but this is the actual situation. So the take care of baby is obstacle or hindering going back of the musculoskeletal system to its normal status. That's why the ladies are developing musculoskeletal problems in their postnatal period. In the following up slides, I'll discuss with you two musculoskeletal conditions based on evidence-based. The first one is the postnatal low back pain. Well, postnatal low back pain, which is experiencing back pain for 6 weeks within the first 3 months postnatal or after giving birth. Estimated that 68% of females are experiencing low back pain during their pregnancy. And the most common area to develop back pain in the area of the lumbar region with the sacroiliac joint, which is highlighted in red color in this illustration. So what are the risk factors to develop a postnatal low back pain? Of course, history of low back pain during pregnancy, younger age, greater body weight, and short stature. Interestingly, they found that lifestyle, sedentary lifestyle, as well as the mode of delivery, either normal delivery or cesarean section with epidural anesthesia, has no risk factor to develop the postnatal low back pain. In the physiotherapy, we have different conservative treatment to deal with the low back pain, like exercise, therapeutic exercises, hot application, ultrasound, laser, TENS, acupuncture, acupressure, kinesiotaping, many techniques. One of them is a manual therapy. I wish that Professor Shawqi is here because he is stressed on this point about the collaboration of research between Ahlia and another institute. And these researches are a collaboration between Ahlia, Bahrain, and Cairo University, Egypt. So we published in the early 2016 paper regarding the efficacy of lumbar mobilization on postpartum low back pain. Without going into technical points, but by the end, we found that the manual therapy in the form of lumbar mobilization has a good effect in decreasing low back pain. Because manual or lumbar mobilization is stimulating the articular mechanoreceptors, stimulating muscle receptors, decrease or inhibit the nociceptors, which is causing the pain, and decrease or relax the muscle tension. another problem which is happening commonly postnatal, which is the carpal tunnel syndrome. And the carpal tunnel syndrome is considered as the most common entrapment neuropathy, which is causing the compression over the median nerve, which is going to the wrist to supply the medial 3.5 fingers of the hand. Women, unfortunately, having a more susceptible risk to develop LCTS with up to 70%, and is this increase up to 62% during pregnancy. So by the end, they're having more than 130% risk factor to develop a CTS. This is another research we published in the early of this year, and this is a graphical abstract which was asked for us to develop to be combined with the paper. As you can see, also the taking of the newborn is hindering the recovery from CTS, which may be developed during pregnancy and continued to be in postnatal up to 3 years, not only the 5 weeks of the postnatal period. So in this research, we try to compare between two electrotherapeutic modalities, which is the pulsed electromagnetic field and the ultrasound in dealing with these problems of CTS. By the end, the two groups showed a significant difference with favoring of the pulsed electromagnetic field. I'm sorry to finish the presentation due to time hindering, but by the end, I want to thank you all for your attendance, and thank you, ladies. Yes, Dr. Said.
Thank you very much for your interesting presentation. Now you have said something about it is in theory it should be straight, I think, and then you said no, it's not.
In theory, what?
In theory.
In theory, what?
Theoretically speaking, when the woman is bending, when she born or whatever, she has a baby.
Yeah.
And then theoretically speaking, that when she born, she has to get to its initial state, right? This is a theory.
No, I said the theoretical scenario that every change happened during pregnancy should go to the normal status after giving birth.
After giving birth.
But due to taking care of baby is obstacling this going back to the normal status. Due to the physical
this doesn't contradict with the theory, you mean?
Pardon?
It contradicts with the theory?
Yeah. No, theory is theoretically speaking, but no
okay.
Theory.
This is you have to. This is what I'm thinking about. And when you say something theory,
no, this is
theory is theory, so
or
you cannot contradict it, right?
Yeah. You can call it metaphor.
The word.
You can call it metaphor.
Yeah.
Okay. Any questions? Okay. You wanna?
Just a quick one on carpal tunnel syndrome.
Carpal tunnel.
Yeah.
Yes.
Does that recur later in life?
Pardon?
Can it recur later in life?
Occur later in life? Yeah. Yes, of course. It has many risk factors. One of them is a pregnancy. But another risk factors like the occupation itself is a risk factor. Holding the mobile is a risk factor. But it has another risk factor. Can happen to anyone in any life stage. Okay, thank you.